My name is Kristen Gray Apple. I'm an acupuncturist and owner of Applepuncture in Lawrenceville, New Jersey. And today I am interviewing Julia Kagan, who is a dentist in Buffalo, New York, and a colleague in the acupuncture world. And to give you a little bit of information about Julia's practice, she also has been an associate dentist at a TMJ dysfunction and sleep disorder clinic in New York City. She has had a long time interest in the complexity of the human body. And from her days in art school, drawing the human figure, and many hours of observation in her yoga practice, she's had a really strong connection and appreciation for the human body and optimizing overall health and well-being through knowledge and compassion. So now going to Julia, we're going to ask Julie some questions about her practice.
Hi, Kristen.
How are you today?
I'm doing great. It's so nice to be here.
It's great to see you. So Julia, as a dentist, what brought you around to acupuncture and wanting to provide that for your patients?
Well, I have always been interested in Eastern philosophy and medicine, and I wanted to integrate that into my practice. So the really nice thing about it is it really helps me express the mouth-body connection to my patients and its role in health and well-being. I found it especially useful in relating to patients as well as for TMJ patients and people who do show some anxiety in the dental office.
Julia, that's really interesting what you just said about the mouth-body connection. Can you say a little bit more about that?
Sure. Well, when there's health in the mouth, there can typically be health in the whole body. It's the gateway to the body. It's where we start to process things such as food. Also, for instance, a way we can see that thoughts are also processed in the mouth is one of the ways that when we have anxiety or stress, our jaw begins to clench or brux and or grind, and we have a TMJ disorder that expresses itself in headaches, neck aches, shoulder pain. It can also affect or kind of come into being at the same time as digestive issues that you might be having, even acid reflux or constipation. There are a number of things that you can see in conjunction with disorders that can be also pinpointed in the mouth.
Mm-hmm.
Wow, okay. So how can acupuncture relieve jaw and facial pain and neck pain? I mean, obviously I know the answer to this question, but please tell us.
Yeah, absolutely. Well, the way that I've been experiencing is a lot of TMJ patients have what we call trigger points, and they occur in the masseter, in the jaw, in the cheek area, in the back of the neck, in the shoulders, the trapezius. That's very common in the temples, the temporalis. So with acupuncture, we can relieve those trigger points, and it also circulates blood to those stagnant areas. It can regulate sleep and digestion, and then just an overall restoration of balance to the body.
Here's a kind of different direction. Can acupuncture do anything for periodontal or gum disease?
Yeah, actually, there have been studies that acupuncture can reduce inflammation associated with periodontal disease or bone loss. Of course, it would be in addition to a thorough periodontal evaluation and cleaning. But yes, there are studies.
So what about acupuncture? I think a lot of people have asked about acupuncture for anesthesia or for pain after tooth extraction or other dental surgeries.
Yes, like a post-operative situation, you could definitely go to an acupuncturist and have a treatment done, and that will definitely help with pain. There's the liver meridian, the stomach meridian are wonderful areas to to use when there's pain associated with the face and the mouth.
Do you ever have patients that use acupuncture for anxiety around dental procedures, or even kids? Do they benefit in this way?
Yeah, absolutely. I have used, I found that ear acupuncture, auricular acupuncture, works really well in a chair-side situation. So when I'm working on dental patients, if they express anxiety to me, I often offer them auricular acupuncture, and it works so marvelously. I'm really just over the moon for the fact that I can use it in my dental practice, because it works instantaneously. There really is no pain associated with it, and it works the entire time. So if I have a very long procedure that I have to do with someone who's anxious, and even if they're not that anxious, but it always just brings the energy in the room down a notch, and it makes it really nice for the patient. And I think even after the procedure, they still have good short-term effects afterwards, and there are no side effects. So it's really wonderful.
Yeah,
that's great. My last question, even though I could ask you many questions for hours, is what about acupuncture for smoking cessation? I know that a lot of dentists are trying to get their patients to stop smoking, and I've had some referrals from dentists for smoking cessation.
Nice, yeah. Well, there's the NADA protocol has been used since 1974 for addiction and detox. It works really well alongside behavioral modification techniques, and it regulates the nervous system and detoxifies the kidney and liver, and also restoring balance to the body. So that's usually not a one-time appointment. That takes multiple sessions.
right.
Mm-hmm.
And usually when it's affecting patients' teeth, it's kind of like a 30-year ordeal of smoking, more than one pack a day.
Absolutely. It's a chronic thing, and it's affected a lot of their systems, including, their periodontal health. So it's really nice to be able to use that in combination with some, periodontal therapies and restorative modalities that we can use in the dental office.